Morning, and welcome to this plenary session this morning. I would have been out here sooner. I looked for the wheel that Dr. Chico rode out with yesterday. Luckily, I couldn't find it. I also want to give a special welcome to the 1,900 international attendees who are here from 91 countries. So if somebody looks like they might need a little help, just go over and help. It's really nice. Our first topic this morning is, are you ready to return to play after a concussion? It's a topic that's been on the media and in my office, and it's an important topic because there are various opinions on it. There is increasing concern about the evaluation is necessary for children after such an injury, and pediatricians are often asked for their opinion. Our next session will inform us. Dr. Mark Hatfield, an assistant professor of non-surgical sports medicine at Washington University in St. Louis, is here to give us some of the answers. He's a primary care team physician for the St. Louis Rams, Washington University, and Lafayette High School in St. Louis, and the director of the Sports Concussion Clinic at Washington University. Let's welcome him now as he discusses, are you ready to return to play after a concussion? Dr. Hatfield.
Thank you, Kurt. Good morning. Thanks for the AAP for inviting me to speak to you this morning. I'm honored to kick off your Sunday plenary session. So this could be a huge, long talk, but I'm given 18 minutes to talk to you, so we'll have to condense this down. So I'm going to give you kind of the highlights. So I have nothing to disclose. So our objectives this morning, we're going to discuss sports concussion epidemiology. I think it's important to set the table a little bit to talk to you about why do we have relevance as far as this particular topic. We're going to go through the current thoughts on grading scales. We're going to discuss the history and relevance of our return to play protocols, and then discuss a little bit about return to play legislation. And basically the bottom line is I want to talk to you about what you really need to know as a pediatrician caring for concussed young athletes in guiding their return to play. Because there's a lot of misinformation, a lot of things that I hear in my clinic as far as information that are given to these athletes as far as when and should they go back to play. So if we look at this slide here, first of all, this is actually 3 recent studies that have looked at the epidemiology of concussions in boys' sports. So one of the things I want to point out, we get huge attention with football, obviously. But one of the things that we don't see as much about is the attention for the other sports that are oftentimes very likely to produce a concussion as well. So if you look at this slide here, the reason why there actually a couple of these only have single bars, some of these sports are not done nationwide like ice hockey and lacrosse. So in those areas of the country that this research has been conducted, we do have data for those. But because they're not done nationwide, they do get little attention. But hockey, if you look at it, not too far off for ice hockey from football as far as the likelihood of getting a concussion in that sport. And same thing for lacrosse. And then obviously we see the other players in here, and there's many other sports that can contribute to getting a concussion as well. And also obviously relevance, you can get a concussion not related to sports, and you could be an athlete and have to talk about returning to play as well. I think one of the things that we don't pay enough attention to is the fact that even though soccer is lower here, there are certainly a lot more athletes out there participating in soccer at all levels, club sports, youth sports, certainly middle school and high school, and probably overall I tend to see the most soccer players in my office rather than the football players. And since for a lot of places it's year-round, we certainly see that as an issue. If we look at girls instead, since obviously football isn't in the picture there except for a few select girls around the country, if we look here, soccer again is the big behemoth here, but again lacrosse is very close to that. And then we see other sports down the road here too. One thing I do want to point out here with lacrosse as an example, so there's been lots of discussion as far as if you know anything about lacrosse. In boys lacrosse, they are required to wear a helmet. In girls, they are not. And so one of the things that's been a lot of controversy is should we have the girls wear a helmet as a reason to help reduce concussions. But honestly, if you look at the incidence of concussions in both boys and girls lacrosse, one helmeted, one not, they're very similar. And probably part of the reason why that is that when you look at those two sports, and one of the things that we have theories about is that when we add more protective gear to an athlete, sometimes that actually changes their approach to that sport, and they may be more cavalier. They may actually go out there and actually reduce the effectiveness of that protective gear because of the increased aggressiveness of the style of play. Or the other thing is maybe helmets aren't all that great. And we do know that certainly from a helmet standpoint, they're great at reducing skull fractures, great at reducing bleeds to the head, but not necessarily so good as far as reducing concussions. If we look at epidemiology, this is the slide that I think I want to drive home because, again, we talk about football a lot. This is looking at percentage of concussions in that particular sport of all injuries. So if we look here, the ones that stand out, again, are the ones that I've referred to before, ice hockey, lacrosse, and then one that I want to definitely bring your attention to is cheerleading. I see a tremendous number of cheerleaders in my office with concussions. One of the things that I find very disturbing is it's very difficult, honestly, to get a lot of cheerleading coaches to buy into the rest that's needed after a concussion. And I tend to see a lot of cheerleading coaches that are much more difficult to deal with getting those athletes to stay out than it is, honestly, for a lot of the football coaches. So again, be cognizant of those cheerleaders that come into your office because they are getting a lot of pressure to return to play. So if we look at grading scales, there's lots of them that are out there, many that have been published. There's American Academy of Neurology's, there's Dr. Robert Cantu's, there's the Colorado Medical Society. So the big question is which one really should you use, if any of them? And so when we look at grading scales, there's actually 30 different, at least, published grading scales on concussions or mild traumatic brain injuries. They're not all related to sports themselves, but many of them are. The big thing to remember about any of these is none of them are evidence-based. None of them predict a clinical outcome. They're based on very few symptoms. In fact, most of them are based on loss of consciousness and amnesia. And I think hopefully most of you are aware that loss of consciousness is actually a very small percentage of those that have that as a sign or symptom from their concussion, in fact, less than 10%. So when we're looking at something that's actually very infrequent as far as the number of signs or symptoms that will produce, it's probably not that great of a predictor. And actually, what was thought to be a big predictor was amnesia, but there's a lot of research now that suggests that actually amnesia isn't a great predictor as far as recovery. So because of the fact that those two are there, probably not the best. If you look at, actually, if any of you are familiar with the Concussion in Sports group, this was a group that brought a bunch of international experts on concussions together that was sponsored by the International Ice Hockey Federation, the International Olympic Committee, and then also FIFA. And they brought together these groups, and they've had 4 meetings now. The first of them was in Vienna in 2001. They had a meeting in Prague, and then 2 meetings in Zurich, the last of which was last fall. They actually recommended abandoning all the grading scales, and that's what I would encourage you to do. I cringe every time I see a grade 1 or grade 2 concussion listed in newspaper reports about athletes who have gotten concussions, because we really don't want to use those anymore. They're not very helpful, and really they shouldn't be what we're using to guide as far as return to play. So let's look at return to play criteria. I think these are important to talk about. So one is asymptomatic at rest. And I would actually encourage you to consider using symptom checklists in your office if you're not. There's several that are out there. If you look back actually at a report that we published through the AAP on sports-related concussions in children and adolescents from 3 years ago, these grading scales are actually in that. And so it's a helpful tool that I like to use in the office for a couple reasons. One is we know that athletes aren't always the most forthcoming as far as displaying their symptoms to you. And if you ask that athlete, yes or no, do you have a headache? I can guarantee you a good percentage of them will tell you no, because they know what will happen if you tell them yes, or if they tell you yes, is you're going to tell them they can't go back to play. So what I do is I actually use these symptom checklists in my office. They get these and they have to fill them out before I even set foot into their room. And what they have to do is basically grade their symptoms. And it's a 0 to 6 scale. So 0 means they have no symptoms, 1 and 2 mild, 3 and 4 moderate, and 5 and 6 severe. And they basically put down what they feel. Now, obviously, we know with symptom checklists, there are many other symptoms that people can have that have nothing to do with concussions, but I think it provides a good starting framework, because then I go through each of those individual symptoms and tell me about these things. When do you have these things? When do you experience these things? And then I get a lot more information about that person's concussion and what may be affecting them. And some of these things they may have at a baseline, so you can tease those out a little bit as well. But I find them very helpful to initially assess someone, then also to use those in follow-up and seeing how they're recovering. We want to gradually increase physical exertion. One of the mistakes that I hear a lot of people tell people is when you're 7 days headache-free, then you're allowed to go back to play. there's problems with that because headache isn't the only symptom related to a concussion. In fact, there are about 3 to 5% of concussions never have a headache as their symptom. And so if you just tell someone headache-free and they're not doing well in school still, and they're still having the cognitive effects of a concussion, that's a problem because they haven't recovered. And then I see athletes that get back to play that really shouldn't be going back to play. And if they're given that 7 days headache-free and they abruptly go back to their sport, I see oftentimes a lot of exacerbations of symptoms, sometimes even worse than what they had at the initial onset of their concussion. So we want to gradually increase their physical exertion. We'll talk about that. We want to make sure that they don't have any return of symptoms when they exert. And we also want to make sure, and I highlight this one here because this is a key about something we'll talk about at the end, we want to make sure they're performing at their pre-injury level in school. That doesn't mean they have to be all caught up with work that they may have missed if they were out for a few days, but we want to make sure that they're back at their cognitive baseline as well. And just to touch on that, just about the whole thing about computerized neurocognitive testing, you don't have to have that. You don't have to do that as a criteria to look at someone to go back to play. There are many places around the country that aren't using them. That's okay. Probably 80% of the concussions that I see in my office don't have baseline assessments. I do that testing. I don't do it if they haven't had a baseline. And so again, we can let these athletes go back to play without having to use those computerized testing. That's not a requirement. None of the guidelines say that it has to be done. And then obviously if they've been on any medications to control their symptoms, we want to make sure that they're off of those medications. I do encourage you, if say an athlete has attention deficit disorder, don't take them off their medicines while they're recovering from a concussion. Let them please stay on those medicines because they really do need them. So most of the grading scales included return to play criteria, and these are all varied recommendations with no consensus. There was, you had one concussion, you're out a week, another concussion, you're out for a month, 3, you're out for the season kind of thing, and I get all the time in my office, it's I've had 3 now, I'm supposed to not be ever play again. Well, no, that's not necessarily the case, but that certainly raises concerns when they've had numerous concussions. But really, again, even some of these until the last decade or so have actually allowed for return to play on the same day. And many of you, in fact, the majority of you in your states, they have legislation now that actually says they're not allowed to go back to play on the day that they've had their concussion. And so again, we want to make sure that they're not going back to play that same day. So just to give you a framework of the history as far as return to play guidelines, our colleagues in Canada actually had a guideline statement that they put out in 2000 that actually the basis that we use now that have actually been widely accepted is what we're going to talk about next here, and that's their guidelines that they put together as far as return to play. One thing to remember about this, again, these are not evidence-based. These were experts in Canada who came up with these criteria, and they've been widespreadly adopted over the last little over a decade now. So certainly some research could be done if there are better ways to actually approach this or what works the best with this particular return to play progression. But to go through this a little bit, so there's various steps. So the first step is no activity. If they're still having symptoms, we don't let them do activity. The objective of that phase is to allow that athlete to recover. Once they have become asymptomatic, then we allow them to start some light aerobic activity. We want to increase their heart rate. And again, we're just doing that kind of lightly to start off with to make sure they don't have any return of symptoms with the increasing their heart rate. We will progress them next to a sport-specific exercises. That's adding some movement into there so we get some other stressors to the system. Then we'll start with some non-contact training drills, and that may even be a non-contact practice. Where again, we're increasing their exercise. We want to assess their coordination. We want to add a cognitive load to that athlete related to their sport. And then we allow them to go to a full contact practice. And again, that's restoring confidence and assessing their functional skills. And then once they've met all those and they haven't had a return of symptoms, then they're allowed to go back to gameplay. So each of these is a 24-hour step. So they do 1 step per day. They can't do any more than that. And if any of their symptoms recur, we want to decrease the level that they were at, that they developed symptoms. And once their symptoms have resolved for 24 hours, we can start that level again. But again, if we keep running into troubles with someone re-aggravating the symptoms, I would pull back that athlete for a little bit, give them a little bit longer period of time, and reassess them. But if you look about this in terms of football, since we're still in that time of year and playoffs are coming in and are coming up for a lot of states, and so the pressure is on as far as we got to get that person back for their districts or their playoffs. If that person really hasn't become symptom-free as a football athlete, basically over the weekend, if it's a Friday night football game, they're probably not going to make this full criteria to be able to go back to play that next Friday. And I wouldn't go and succumb to pressure as far as letting these athletes back too soon. I like one of the posters that I've seen about concussions, it's better to miss 1 game than miss a season, and I certainly advocate that approach. So if we look at return to play, so in a patient with multiple concussions or prolonged symptoms, that's where I think it's probably worthwhile to enlist someone who's dealing with concussions on a more consistent basis. And so that may be enlisting a primary care sports medicine specialist, or neurologist, or neurosurgeon. And again, this is where you have to know your neurosurgeons and neurologists. Most primary care sports medicine doctors have had extensive training in concussions. Neurologists and neurosurgeons, obviously their specialty may or may not be in that particular area. And so again, it's knowing your specialist that you're referring to. And we may need to adjust the time frame as far as return to play for these particular athletes and giving them a longer period of time. So again, there's no set criteria for these. Typically, if someone's had 2 in a season, I'm going to give them a longer period of time off. And again, that's variable from athlete to athlete. There's not a set thing in stone. Certainly, again, if you've had multiple concussions, you want to consider a long period of time out of contact sports. But if they've had, say they're asymptomatic and they're doing fine, and they've had multiple concussions, we can allow them to go back to non-contact sports and let them participate in those. So it's not that they have to be out of sports altogether. I want to touch a little bit on the topic of retirement from sports. How many is too many? And really the answer is unknown. There's no magic number that's out there, and that's what I tell every athlete. I've retired athletes after 1 concussion, some that have had symptoms that have lasted for 1.5 years, and I'm like, do we really want to potentially go through this all over again? And usually with the family is no. And so in that sort of situation there, we will retire those athletes from contact sports earlier. I've had athletes that have come in with multiple concussions that we've had to retire. And so again, there's not a magic number that's out there. There's no agreed upon criteria as far as what establishes when you need to retire an athlete from their sports. It really has to be an individualized approach. And the question is whether or not you have to exclude them from all sports. And again, this is where non-contact sports come into play. I was a cross-country runner in high school, so hey, less likely getting a concussion there, go out for cross-country. So some things that I would consider as far as making my determination, and again, I tell all the athletes, a lot of families will ask me, well, when is too many? And I tell them there's really no checkbox that we use. It's not I meet all these criteria and then now you're out. So I'll look at the number that person's had, what the duration of symptoms that athlete may have had as far as each of their concussions. And one thing to remember and to stress with families, they're all individual. In that particular individual, if they have multiple concussions, they may have varying levels of symptoms at with various concussions. They may not have all the same manifestations, so it's not that you've had one and you're guaranteed to have a longer recovery or prolonged symptoms for the next one. That is certainly not the case. I look at the injury's effect on the life of that patient. Had they had to have a prolonged period of time out of school, what effect that's had at the family. I had one kid that was so severely affected that the mom insisted that she had to stay home, and she actually wound up losing her job because of that. So again, those are things where probably an extreme there, but one of the examples that I like to give. What sports they play. So obviously that's where the epidemiology of concussions come from, as far as knowing what sports may be at higher risk. This also comes into play when an athlete may be participating in multiple teams at the same time, again, increasing their likelihood of exposure to a concussion. What positions they may play in that particular sport. Obviously some sports, some positions are at higher risk. Catching in baseball is an example, being a high risk. Style of play, so the athlete that tends to be the aggressive athlete that is always going after the ball or just plays with reckless abandon, that's an athlete that's going to be putting themselves at risk for one. And then what really are the long-term goals for that athlete? Like every kid that comes in my office, they're the next great, insert your best professional athlete for that sport. That's what my child is going to be. Obviously, if you look at NCAA data, I can burst a lot of bubbles and a lot of dreams and hopes by looking at NCAA data as far as who actually goes on to professional sports, even getting to the collegiate level, much less professional, and making their living off of those sports. And so, again, I think it's putting that into perspective. And again, they're going to need the brain for the rest of their life to manage life rather than just worrying about sports in grade school, middle school, or high school. And then touching on return to play legislation, so this started with the Zachary-Lystead law in Washington State in 2011 and then has now spread to 48 states and the District of Columbia. So the features of the Lystead law mandates a preseason education for parents and the student athlete. There's no return to play after a suspected concussion for 24 hours, and so the adage of when in doubt, sit them out, I think is appropriate. And then they need written clearance by a healthcare professional prior to return to play. And that healthcare professionals brought a lot of debate at a lot of state levels as far as who's allowed to allow someone to go back to play. But certainly, obviously, physicians are in that group. And so this is a map that was provided by our state government's affairs office. So the red states here, and this is not a red state, blue state thing, okay? So the red state part here, those are actually those that have return to play laws that allow both physicians and other healthcare professionals to allow return to play. The light blue states only allow physicians to return to play. And if you're in Mississippi or Wyoming, you need to get your acts together because you don't have laws in either state. There is one technically in Wyoming, but it actually doesn't have anything as far as holding an athlete out or requiring written permission to go back to play. So if you're the 2 holdout states and you're in this room, I'm watching you. And then the last thing I want to touch on very briefly, so today we've actually released a new clinical report that's called Returning to Learning Following a Concussion. This is not just applying to athletes, this is for all levels here from grade school on up. We wanted to provide a framework for all of you as far as what are some things that you could use in your office to getting these athletes and getting these student athletes and getting these students back in the classroom setting. I think there's way too much focus on returning to sports, not enough emphasis on getting these kids back into the school environment, which is priority number 1. And I think from that standpoint, hopefully this will provide a good starting point and a framework for all of you to reference to. Thank you.